Hi, everyone. Thanks so much for tuning in. In 2018, I led a group of students to explore a clinical question regarding the use of transcranial direct current stimulation for motor recovery in adults post-stroke, specifically in inpatient rehab settings. So just to start with a little bit of background, non-invasive brain stimulation is gaining popularity as an adjunctive treatment to excite or inhibit brain areas that are affected by stroke. Transcranial direct current stimulation, or TDCS, specifically is a form of non-invasive brainstim that is both affordable and has been shown to be safe for use in individuals post-stroke. TDCS units are commercially available and are currently being investigated for several clinical applications, including depression, schizophrenia, aphasia, addiction, epilepsy, chronic pain, attention, and also in motor rehabilitation. One of the things to consider in the US, it's not currently FDA approved and has been deemed investigational by the FDA. Therefore, it can only be provided as off-label treatment at this time. In several other countries, though, it is approved for medical treatment. TDCS can be applied in one of two ways primarily when you're targeting motor rehabilitation. So if the anode is placed over the ipsilesional motor cortex, it's going to excite the injured cortex in order to upregulate its usage. And then if the cathode is placed over the contralesional motor cortex, it inhibits the contralesional cortex in order to allow increased activation of the lesioned M1 or motor area. The concept itself of interhemispheric inhibition post-stroke still remains controversial, but the ability to stimulate or inhibit the motor cortex via transcranial stimulation may actually contribute to neuroplasticity. There have been some recent systematic reviews in the last 5 years exploring this topic in chronic stroke, but they didn't hone in on the acute or subacute population post-stroke, specifically those in inpatient rehabilitation. So the overall purpose of the critical review that my students and I performed was to investigate the latest findings in TDCS as an adjunct to traditional rehabilitation in adults post-stroke, specifically in an inpatient rehab setting. The literature review itself was conducted around a clinical question in the PIO format using keywords to search for relevant literature. The inclusion criteria that we agreed upon was articles had to be level 1B or 2B evidence. The population had to be adults post-stroke and inpatient rehabilitation. Specifically, TDCS had to be the type of non-invasive stimulation that they were using. There had to have been data collected on outcome measures for motor recovery, and the studies had to be completed between 2013 and 2018. Studies were excluded if subject age was less than 18, if the subjects were seen in an outpatient setting, and if there was no sham control. And I also want to note that we included studies that used various applications of TDCS. We didn't include or exclude based on the type. So some used anodal, some used cathodal, and some used bihemispheric. In total, that we reviewed, 7 studies met our inclusion criteria, with all 7 at a level of evidence of 1B. 3 studies targeted the motor cortex of the lower extremity, and 4 studies targeted the motor cortex of the upper extremity. All were dose matched and had sham controls. The TDCS intensity varied across studies from 1 milliamp to 2 milliamps, which is well within the established range of safety that was found in several foundational studies. TDCS arrays or setups varied across studies, with 3 utilizing the anode over the ipsilesional cortex, 3 utilizing the cathode over the contralesional cortex, and 1 using a bihemispheric setup. 6 out of the 7 studies that we included saw statistically significant improvements between the experimental and control groups in the areas of static and dynamic balance, fall reduction, motor control, gait speed, dexterity, coordination, and ADL performance. And it's also important to note that 3 studies administered the TDCS pre-intervention as a primer for movement. 3 studies administered it concurrently with their interventions, and 1 study didn't specify the timing of the administration. So overall, the extracted articles support the use of transcranial direct current stimulation as an adjunct to traditional inpatient stroke rehabilitation interventions as a method of enhancing motor control or motor recovery post-stroke. The use of TDCS was efficacious in both the upper and lower extremities for rehabilitation purposes. Outcome measures that were commonly used in the clinic that demonstrated significant improvements included the Fugelmeyer, the timed up and go, 6-minute walk test, Berg balance scale, action research arm test, box and block test, FIM, and 9-hole peg test. It should be noted that the primary outcome measures utilized across studies focused on the body structure and function level rather than the activity level, according to the ICF model. However, statistically significant differences between groups were seen at both levels. All studies that we included adhered to the safety guidelines for both intensity and duration of stimulation. Up to this point, there is no consensus on whether it's best to use TDCS as a priming technique pre-intervention or as a concurrent technique during intervention. So further research needs to be done with that. Additionally, the electrode placement varied across all studies, so it's difficult to determine the best array strategy at this point, whether you're doing the ipsilesional anode placement or the contralesional cathode placement. Current literature has explored both options in addition to combining the approaches simultaneously, but overall further research has to be done to determine the optimal dosage, electrode placement, and timing of implementation in order to attempt to standardize a protocol for use in a clinical setting. But overall, the clinical bottom line is that transcranial direct current stimulation is an efficacious adjunct to traditional inpatient rehabilitation for improving motor recovery in adults post-stroke. Thank you so much, and I'm happy to leave my email if you have any additional questions. Thank you.